Let me know what's going on here today.
Yeah, so Dr. Biggs and Dr. Neese had reached out to me on Facebook a little over a week ago and let me know that they were kind of in a bind right now. Amarillo in general was in a bind with regards to testing. They had the unique ability to test with the new rapid test that had come out by Abbott. They had the machines available, but they didn't have any of the testing material that they needed to actually do the COVID test. So I had made some phone calls with some of the members of the task force, reached out to them, and I thought I had some headed our way in the mail. And we were supposed to receive them in 48 hours, and something happened. There was an outbreak somewhere, and they got commandeered on the way here and rerouted to a hot spot somewhere, so we lost them. I think they made it as far as Dallas, and then they never made it the rest of the way here. So I made a few more phone calls. I jumped on a plane, and I flew to D.C. I met with some members of the task force. I met with the president, the vice president, about some other issues, including, but also talked about the COVID-19 and what's going on right now. And I was able to make some contacts while I was physically there face-to-face and acquire some of the new rapid tests for the Abbott machines. And then I just threw them in my pickup and jumped in the truck. I didn't want to take a chance on having somebody mail them and get them rerouted again. So I just put them in the pickup and I drove them. Drove 16 hours day before yesterday, 9 hours yesterday, and just arrived back late last night. But we have some tests, and it's not a ton of tests, but it's enough to get us through a period of time until we can get some more in the mail. So I think we have some more headed our way, but I wanted to make sure that there wasn't a gap in the ability to test. So this will fill the gap a little bit here. So I'm proud to be able to help out.
So what went into the decision for you just to go get them yourself and bring them?
Just a little frustration, I mean, I was trying to work it on the phone and get them mailed, and everybody, of course, is trying to get them all over the country right now, and everybody's got needs, and some are greater than others. But here in Amarillo, there was really no ability to do this at all. The tests that we were doing at the time were being sent to Lubbock, and there was an extensive turnaround time on them, and so they needed the ability for certain purposes to have a rapid test that they could do here in Amarillo. It's key for some of the efforts to beat this virus down and to get past this, to get over the hump. So I just thought it's an important thing to do. I'm not campaigning right now because of everything that's going on. The campaign is kind of we've taken a backseat on the campaigning. I wanted to make sure I was doing something. I live here in Amarillo. I'm a member of the community here. I wanted to make sure that I could do what I could for the community. I'm a physician, so I said, you know what? I'm just going to go there myself. I'm going to talk to some people. I'm going to gather some tests up, and I'm going to bring them back. So that's what happened.
That's awesome. With the shortage of all these tests, how important is it for Amarillo to be getting these tests?
Well, it's really important. I mean, there's certain communities, whether it's our first responders or people that are working in the hospital and things of that nature, that have key roles in fighting this virus. They need to know at times if they've been sick or if they're feeling sick, whether or not they have this, and because they may have exposed other coworkers, and they may have exposed patients. Some of the patients may have comorbidities and be critically ill and be really vulnerable to this kind of stuff. So it's important for the community and for the patients in this community, for some of the healthcare providers, some of the first responders, to be able to get tested and to know right away whether or not they do or don't have this virus, and so that the public health people in Amarillo can make the decisions that they need to make.
A lot of people forget that Amarillo just isn't for Amarillo. Amarillo supports the whole Panhandle.
That's right.
Oklahoma Panhandle, Eastern New Mexico. How is it important for Amarillo to get the supplies they need to help these other communities?
Well, you're right. It's really important. I mean, this is mostly rural area, and everything here is rural healthcare for the most part. Amarillo really is the hub here, the big city per se in the Panhandle, and literally all of North Texas. And the 13th congressional district has two major cities, Amarillo and Wichita Falls, and Amarillo is about twice the size of Wichita Falls. And Wichita Falls has the added benefit of being close to the Dallas-Fort Worth area, so they have better resources. Amarillo's they're not blessed with that kind of proximity to another large city like that they can fall in on, that can help them bridge the gap. So they are kind of we here in Amarillo are kind of on our own sometimes, so we need to take that into account. And everyone across the country, and certainly people in D.C., they don't really get that. They don't understand how isolated the folks up in the Texas Panhandle are sometimes when it comes to issues that like the ones that we're facing right now with the coronavirus.
Perfect. Is there anything I left out you want to talk about?
No, I don't think so.